So it's 10 o'clock. I think people will continue to join, but maybe let's make a start so we've got plenty of time for discussion. So thank you all for joining. This session is mainly to discuss the findings from the Teachers and Teaching Independent Evaluation Study. We'll be hearing from Dr. Manaza Aslam and Dr. Shanila Rao shortly in relation to that. We will also have a brief overview of one of the upcoming studies that's focused on disability that Professor Nidhi Singhal will talk about towards the end of the webinar. Just to start by saying, I was last night at an event with Helen Grant, and she asked me to summarise what was good about the Girls' Education Challenge in 3 words. So I'm going to let you all contemplate what your 3 words would be. So mine were marginalised, innovation and evidence. So I think the discussion today will be very much bringing together those 3 aspects in relation to teachers and teaching. As usual, please do put things in the chat as we go along, and I think Manaza and Shanil, you'll be speaking for about half an hour, and there'll be then time for questions and answers and discussion. Just want to start by saying a huge thank you to the implementing partners who have been really vital and central in this Teachers and Teaching study, and I think we'll be hearing more about that shortly. So over to you, Manaza and Shanila.
So good morning, everyone. I'd just like to thank you all actually for taking the time to listen to our presentation today. For those of you that don't know me, I am Shanila Raval, and I'm here with my colleagues who worked on this study with me. So you've just heard from Professor Pauline Rose, who led this study. We've got Dr. Manaza Aslam on here as well, who'll be joining in the chat later. We've also got other team members from Tetra Tech, Fab Inc., who were also involved in the study. And initially, I'm going to present the findings of the study, and then, as Pauline said, we're going to open up the floor to questions and discussions where there'll be plenty of opportunities for you to speak to other team members as well and hear their insights as well. So if I could ask Louise to please share the screen. And if you can move on to the first slide. Thank you. So as you all know, the GEC was launched by FCDO in 2012 with a commitment to supporting the education of over 1 million of the world's most marginalised girls. And as you know, it's currently in its 2nd phase that is funded through the 2 windows of the GEC Transitions window and the Leave No Girl Behind window. Well, in February 2020, FCDO commissioned Tetra Tech to lead a consortium of partners, including the Real Centre at Cambridge and Fab Inc., to conduct an independent evaluation of the GEC Phase 2. And this was to consist of a series of evaluation studies on various aspects of GEC2 implementation and outcomes. So as is well recognised globally, teachers play a critical role in enhancing children's education, and improving teacher quality is seen as one of the most important mechanisms for improving education outcomes. And so in recognition of this, improving teacher quality is one of the 8 intermediate outcomes set forward in the GEC2 Phase 2 theory of change. So correspondingly, one of the first 2 studies conducted by the independent evaluation team focused on how GEC2 projects have engaged teachers and emphasised teaching quality to improve girls' education. And this is the study that we're going to be looking at today. And the study focuses not only on looking at teacher demographics, so who these teachers are, but also their pedagogical practices, and most notably, how they teach marginalised girls in their classrooms in terms of what they do. So who these teachers are and what they do. And as Pauline mentioned earlier, engagement and collaboration with the fund manager, but also with implementing partners. So the IPs that were involved in this study throughout the study has been really valuable. And I'm hoping, I can't see the list of names of everyone that's here, but I'm hoping that some of the representatives from the IP are here, and as well as representatives, obviously, from the fund manager as well. So moving on to the next slide, the study focuses on 2 research questions. The first research question 1, looks at how GEC2 projects have implemented and adapted interventions with teachers and teaching prior to COVID-19. And the second research question looks at how they've adapted their interventions during the pandemic. So not only to help girls to learn at home while schools were closed, but also to return to schools and also to support them in other learning spaces. And the study aimed to focus on areas that were identified within the literature as being important. So issues such as gender responsive pedagogy, the role of female teachers, and teacher professional development. The next slide shows you our approach, and it shows that the study actually utilised a mixed methods approach and analysed both primary and secondary data. So in the first instance, the team carried out a project mapping exercise from which a long list of 10 GEC2 projects, which included a strong focus on teachers and teaching, was selected for inclusion in the study. And the study team used both project documentation, analysis of project level, external quantitative evaluation data to answer the first research question 1. So this was the one on how interventions look to improve quality of teaching prior to the pandemic. And the 10 projects that form this long list are shown in black on this slide, and they form the basis of secondary data analysis that was conducted, as I said, for research question 1. In addition to this, for a short list of 4 projects that are shown in the slide here in purple, primary qualitative data were collected through a series of 187 key informant interviews in country, 31 focus group discussions, and 60 narrative classroom observations in 3 countries of focus: Afghanistan, Ghana, and Sierra Leone. This took place between March and May in 2021, and these data, along with a review of project adaptation plans, were used to answer research question 2 on the teaching and learning experience during the pandemic. Further insights into the context in which these interventions were operating was also evidenced through a political economy analysis. And so that used these data, but also used additional key informant interviews that were conducted with critical stakeholders from the wider education sector. So, for example, members of national and local government, representatives from the implementing partners, community members, parents, etc. So it was a purposive selection strategy, and it involved projects being screened and selected based on a set of clear and specific criteria. So we looked at things like whether there was a focus on teachers and teaching, the availability of secondary quantitative data, what country was being operated in, the feasibility of collecting primary data, amongst other things. And so as such, these selected projects should not be considered as representative of the wider GEC2 portfolio, but rather those that included specific interventions related to teachers and teaching. It's important to say that this report was completed in July, early August, 2021, and this just gives you a bit of a sense of timing, not only in terms of COVID, but also in terms of other political events that were happening at that time. And it really is a testament to everyone's commitment that this happened at such a time of immense pressure. So looking at the next slide, in the first instance, I'm going to look at some of the evidence that we found from our analysis pertaining to research question 1. And as I said before, research question 1 looked at the ways in which the 10 GEC2 projects selected for this study planned and implemented interventions related to teachers and teachers prior to the pandemic. And one of the things that was found that the IPs in this study engaged with different types of educators to deliver their programs. And this enabled them to cater to some of the most vulnerable girls in remote, rural and conflict-affected settings, because they were then able to develop flexible teaching and learning models where otherwise learning may face challenges, particularly in recruiting professional teachers. So for the purposes of this study and for GEC2 generally, there's no typical teacher. It encompasses a wide range of teacher and educator roles who are engaged with the program, and these may be educators who are directly recruited by the IPs for their programs, or they may be supported by the IPs in existing schools. So, for example, government teachers, and they work with head teachers, community-based teachers, some teachers who don't have formal qualifications, so paraeducators such as mentors and facilitators. The GEC programs also include models where there are teacher educators, so where you have master trainers or project staff who are delivering training to other educators or to other teachers. And our analysis here found that between 2017 and 2020, around 60,500 teachers were the beneficiaries of teacher training and related interventions provided by this 10-long list of implementing partners. And of these, approximately 25,000, so around 40%, were female educators. So looking at the next slide, evidence also garnered for research question 1 found that each project took a differentiated and targeted strategy to achieve its aims. And this depended on nuanced contextual barriers and enabling factors. And it meant that they could support their diverse range of teachers in a range of means. All 10 external evaluation reports reported that there were specific supply side barriers related to teachers in teaching that informed how and why they implemented and developed their interventions to improve the quality of teaching. And the top 3 teaching related barriers across the 10 in this study were: number 1, the shortage of female teachers, safeguarding and child protection concerns, and low quality teaching school infrastructure and facilities, as shown by the figure on the left hand side of your slide. Now, as the quality of teaching is key to improving learning, it is really unsurprising that all 10 implementing partners offered multiple interventions designed to improve the quality of teaching across the GEC2 teaching cadre, and they were designed to address these aforementioned barriers. The main intervention reported by all 10 projects to improve the quality of teaching was teacher professional development. But there were other interventions also, such as providing additional and remedial classes, school leadership and management training, also providing learning resources within the classrooms. And some, I think it was 2 projects that also said that they provided additional teaching support in the form of learning assistance. Prior to the pandemic, teacher professional development, as you would imagine, was primarily disseminated through traditional classroom-based teacher training. But there were also other formats as well, such as teacher peer learning. Whilst there was limited information on the content of this training in the project documentation, it was found that the majority of the projects indicated that they included some form of gender-responsive, learner-centered and inclusive pedagogical approaches in their training. The teacher training from our evidence appears to have improved not only pedagogies, but also self-confidence in teaching and awareness on issues pertaining to child protection and safeguarding. But one of the things that was found from the project documentation was that some of the IPs did not appear to routinely be assessing teachers' knowledge, skills and competencies, or linking these elements to evidence on students' learning needs. 2 of the projects were undertaking interventions designed specifically and explicitly to increase female teacher pipelines. And some of the IPs were also undergoing activities to transition community-based educators into the mainstream teaching system once projects had closed, in order to improve the sustainability of interventions. Moving on to the next slide, which is the evidence for research question 2. So as I mentioned to you before, this was on a short list of projects, 4 projects in 3 contexts, and looking at the time period during COVID. So just to give you a little bit of a sense of context in terms of the countries that we were looking at, in all 3 countries, a sizable proportion of children do not complete primary school. Girls are less likely to complete primary school than boys in Afghanistan, while the opposite is the case in Ghana and Sierra Leone. In secondary, at the secondary level, the gender gap is very wide in Afghanistan, and completion rates are similar for boys and girls in Ghana and Sierra Leone. In addition to this, there's a wide gender gap in Afghanistan in terms of literacy. However, and Afghanistan also has the lowest literacy rate across the three countries. Sierra Leone has slightly lower literacy rates for girls than for boys, and it's reported as being relatively similar in Ghana. Interviews that we had with stakeholders indicated that across all three of these contexts, social and cultural factors such as early rates of early marriage, low value of girls' education, and high burdens of domestic work are the key barriers to education for girls. And interviews also indicated that there were critical challenges in terms of equity, teaching quality, and learning, lack of resources as well that are affecting the quality of girls' education. Other issues were also highlighted, such as inadequate school infrastructure, and in particular, the lack of sanitation and hygiene facilities. And actually, respondents that we were within this study suggested that some of the community-based schools may be better equipped than the government schools in terms of classroom resources and school infrastructure, because this was often provided by the implementing partners. It's important to note, as all of you will know, that the education systems in Afghanistan and Sierra Leone have been severely affected by conflict, and the effects of conflict in Sierra Leone were exacerbated by the outbreak of the Ebola virus in 2014 and 2015. And as we all know, globally and across these contexts, the pandemic also exacerbated key supply side and demand side constraints to girls' education as well. Moving on to the next slide and looking at sort of more national level responses, it was found that governments in all three countries closed their schools in March 2020, and these school closures ranged from between 4 and 10 months, and this really further reinforced limited progress in girls' education. There were wider restrictions in all three countries, so for example, limits on numbers of people gathering, restrictions on internal and external travel. However, during the school closures, education ministries in all three countries introduced alternative education programming. So things like distance learning through the internet, through radio and through TV. However, access to technology and resources also raised equity and gender concerns, and it meant that large numbers of learners were not being reached. Governments, as we can see from this chart, in all three countries began phased reopening of schools. This tended to start from about June or July in 2020, and in all three countries, priority was given to the exam grades. Looking at the next slide, thank you, Louise. One of the things that we found from and specifically looking at the IEPs who were part of our selection for this study, we found that IEPs were proved really adaptive in their response to the pandemic, and they all introduced major adaptations to the format of their interventions related to teachers and teaching during school closures. And this was primarily done by moving towards remote or adapted learning models, or in some instances pausing some activities. In addition to these remote learning models, all four IEPs also incorporated efforts, to monitor girls' well-being and also to support the girls in terms of health information and resources as well. And it was found that because these IEPs drew on their existing project infrastructures, their existing resources, and their strong stakeholder relationships, it meant that they were in a really good position to mobilize their resources and respond to the situation and make rapid adaptations. Projects reported key barriers that arose because of the impact of the pandemic and the lockdown measures, and these included things like increased domestic as well as income generating duties, which resulted in lost learning time for learners, the high risk of dropout, as well as barriers to learning that arose from the effects of the pandemic on learners' psychological well-being. And all of the IEPs tried to implement interventions to circumvent these barriers. Since the schools have reopened, IEPs have introduced, key changes to the format and the scheduling of learning activities, as well as to making sure that they've adapted things to ensure that learners could return to schools or return to their safe spaces. Most of the changes that were implemented to provide remedial or catch-up lessons, also to accommodate things like smaller groups of learners to enable social distancing measures, and also adaptations that they've had to make to introduce other COVID-19 safety measures. So, for example, the need to incorporate things like hand washing facilities or other sanitization facilities. So looking at the girls' experiences on the next slide, one of the things that it was found was that all of the girls really seemed very positive about their remote learning experiences. And this was particularly the case when communication with teachers was two-way and they were able to sort of clarify any questions that they had. The quote at the top of this slide is really interesting because one of the learners said that if it hadn't been for the teachers' help and if they hadn't called them and reminded them of their lessons, they potentially would have been indifferent to their lessons and forgotten the things that they had been learning. Most teachers and girls did, however, say that they preferred, obviously, in-person learning to remote learning. And it was found that this remote learning and teaching came with some gender-related and accessibility-related problems, such as low access to technology, as I said before, increased domestic responsibilities, also inadequate resources at home. And as I said, there was often limited resources for or avenues for feedback from caregivers. And so the IPs actually, in many instances, provided paper-based home learning solutions and made facilities such that it enabled two-way teacher support in order for them to help address some of these barriers. All of the IPs identified girls' social and emotional well-being as being a priority for them during the pandemic. And as a result of this, it was found that teachers' roles really expanded from being mainly educational to sort of a wider and broader support function. So they were essentially the front line to providing not only continued and adapted learning, but also they were key in terms of providing health and safety, psychosocial and well-being information and support for these girls by checking up on them, as well as by disseminating COVID safety information and things within the communities. And we saw evidence of this as shown in the quote at the bottom of this slide here, where one of the learners talks about how the teachers told them about hand washing and social distancing and other things such as this. And this teacher engagement was really found to be very valuable, particularly in communities and places where parents had low literacy levels. And in particular, the female educators, so the female community-based educators, were seen as being instrumental in providing the support, because the extent to which male educators could support girls was really limited in these countries due to safeguarding concerns. Also, generally, a lot of the community-based educators were recruited locally. So, for example, they had the advantage of being able to move around during lockdown periods as well. And it's really important to note that these teachers themselves also faced a lot of challenges. And in particular, female teachers did, because they were disproportionately affected with their expanded, teaching responsibilities being compounded by, increased domestic responsibilities, issues with supplies of resources to distribute, and also their own inability to access technology. So the next slide looks at, what was done to help support these teachers. And actually, one of the key things, as I mentioned before, teacher training was one of the key things that were done by implementing partners prior to the pandemic, and continuing teacher training during the pandemic was also a priority. And all of the IPs said that they provided adapted training modalities, but also adapted content to reflect the changing education and well-being needs of learners in the wake of the pandemic. Most of the adaptation was the switch to sort of distance or small group settings that was delivered either through phone or satellite-based training for teachers, particularly during school closures. IPs, as I mentioned earlier, also adapted training content. So it needed to reflect the expanded roles of teachers. So they also provided things on psychological first aid and COVID safety. And evidence that we found was that teachers were really very satisfied with the training that that they received, not only in terms of developing teaching methods and subject knowledge, but also in terms of giving them the ability to support marginalised girls as well. And it was found that some of these IP trainings may have really filled gaps in teacher training that was being provided by governments as well. And also, once schools reopened, IPs made changes to teaching and learning activities to accommodate the need for, as I said earlier, remedial or catch-up lessons. And across the project, it was found, there was evidence found that teachers used formal and informal assessment means and questioning techniques just to gauge learning levels. And girls talked about teachers sort of checking where their learning was and repeating content before moving on to new content. And the quote on the slide here is really an example of a teacher who said they really appreciated the project training and support and how it helped them to teach students in a better way. So once the schools reopened, if we go on to the next slide, we were able
about 5 minutes, Shanilla, sorry.
Yeah, perfect. We were able to conduct classroom observations in sampled schools. And in this diagram, you can see how we not only drew the layout of how the students were sat, but we captured the narrative chronology of the lesson. And it looked at interactions between students and learners and teachers and learners themselves. And overall, it was found that during the classroom observations, teachers adopted positive behaviours, positive body language to all learners. And there were specific strategies that were used to make sure that girls were engaged. So, for example, physically moving around the classroom, encouraging shy or hesitant girls, and explaining the content in different languages. Whilst there were a very small number of instances where teachers recorded to have made gender bias statements, there was really no variation across, teachers' own gender and the implementation of gender responsive practices. So this suggests that while female teachers can be influential mentors, all teachers continue to require support for implementing gender responsive pedagogies. So moving on to the next slide, as I mentioned to you earlier, all of the IPs have prioritised child protection and safeguarding activities, and all of them have included this within their training. And the teachers who have received that training, as is shown on the slide here, have reported that it's been really helpful for them, not only in developing their own self-awareness, but also in influencing their perspectives and practices. But school-based, gender-based violence is really a concern, still a concern, especially in contexts where corporal punishment is legal. It's really important to say that in schools where IPs are not recruiting their own teachers, or there may be situations where they have limited oversight or influence over teaching practices as well. So moving on to the final slide, the study concludes with recommendations that have been framed for future interventions by FCDO, but also for education-related interventions more widely. And overall, the key recommendation is that all projects working to improve learning for marginalised girls really needs to explicitly consider interventions relating to supporting teachers in teaching, because these teachers are vital points of interaction. The report itself covers recommendations under each of these categories shown on the slide here. And I'm not going to cover them in depth, but I would say that definitely please do look at the report to be able to see them. But some of the sort of key headline things in terms of teacher recruitment, community-based teacher recruitment models are really appropriate, can be an appropriate means of addressing teacher shortages. But it's really important from a sustainability perspective to consider from the outset whether these models can be transitioned or adopted by government systems. In terms of teacher professional development, training should include, as we know, gender responsive pedagogies, and other elements that we talked about before, but also they should ensure that there are feedback mechanisms in place to show that the training is being implemented as it was intended. In terms of remote learning models, teaching models based on home learning really do need to be two-way in order to allow girls to have avenues for continued support and feedback, but also to keep them engaged and motivated. And also, it's really important but to ensure that teachers' well-being is also put at the forefront, and sort of a needs and well-being assessment for teachers is conducted, given that their roles expand in these sorts of situations. Finally, the report looks at some areas of further research, as well as looking at things in terms of what could be improved in terms of data. So one of the things there is that, you know, any future girls' education projects that are designed to improve the quality of teaching should really collect and directly link data on changes in girls' learning outcomes to changes in teaching quality that have occurred as a result of these interventions. And this would require not only linking these data, but also tracking teachers over time to make sure that you can adequately assess any changes that are taking place. But yes, as I said, I would really encourage you, try to cover as much as I possibly can of the report, but I would, you know, for those of you who haven't, really encourage you to read the full report. But I'd like to now open it up to the rest of my team members to start, you know, answering some of the questions or comments that you may have. Thank you.
Thank you, Shanilla. Louise, I think we can take down the PowerPoint for the moment. And thank you for that comprehensive overview. I've put in the chat a link to the report and a brief news story so everyone can access that. And I know that we have some of the IPs on the call here who were the focus of the four case studies that Shanilla was particularly focusing on. And it's worth remembering that going back to the selection criteria, they were selected because they were doing things more proactively in relation to teachers and teaching. So we were keen to learn from that experience for other work in girls' education. There's one question in the chat from Gandhari, and please do either put your hand up in the usual Teams way or put some comment in the chat. So the question on what inclusion gender responsive strategies were included in teacher training to ensure inclusion and equity in education. I'm not sure that we have the details on this, but Romanshi, I don't know whether you have any insights on that question. So Romanshi is also here as one of the report team members.
Thanks, Pauline. So to answer the question, unfortunately, that was actually one of the findings, that the teacher training didn't include, or the documentation on the teacher training didn't always include the specific content. So while IPs indicated that they did include gender responsive modules and inclusive education modules, we couldn't necessarily assess what sort of content was included.
Thank you, Romanshi. So any other questions or also comments from any of the IPs, as I said, in particular those who were involved, we'd love to hear from you. So there's a question from Angela on, was there a focus on the type of teacher professional development, i.e. training versus COPS, the communities of practice, sorry, get lost in the acronyms, mentoring and coaching that is most effective? That wasn't the focus of this particular study, and we wouldn't have had the data in order to answer that. So I think that also goes back to Shanilla's last point on the type of data that's available. But Manazra and Shanilla, I don't know if you want to add anything to that. So there's certainly a lot to learn about what we could learn more about as well. It might be worth mentioning, given that both those points are on teacher training, that the Global Partnership for Education has also recently done a study on teacher training during COVID in relation to the work that they've supported. And there's quite a lot of synergies in terms of the findings and recommendations, I think.
And so, actually, that was one of our recommendations as well, is in terms of not only the content of the teacher training, but then also later on going into the classrooms, assessing whether the training was implemented as intended as well. And I think that's the case across a lot of a lot of the research that I've done in other settings as well. There's limited information on what the training actually includes, then linking that, but I've seen very limited evidence on saying whether the training was implemented and those feedback mechanisms as well, and then tracking it and linking it with students also.
Thanks, Shanilla. So there's a question from Barbara on, can you explain the finding that teacher characteristics didn't appear to influence implementation of gender responsive pedagogy approaches?
Yes, I can start, and then maybe some of the other team members can say something. I think what we found was that actually, firstly, as I said, all of the trainings included those elements, and it was found that all teachers, irrespective of their gender and irrespective of their other teacher characteristics, were implementing gender responsive pedagogies and inclusive pedagogies. And so one of our findings, and actually in situations where this wasn't happening, and in the limited, numbers of instances, as I mentioned, where this wasn't happening, it didn't seem to be related to the gender of the teacher or any other characteristic of the teacher. And so actually, what we're saying is that all teachers, irrespective of their own characteristics, really need not so much training, but I think one of our recommendations was need support in how they implement these strategies, particularly, and this is, I think, the vital point, given that they are working in resource constrained, but also very challenging environments as well. Also, sorry, the other point that I'd mentioned briefly as well is in a lot of these situations, the teachers are not necessarily recruited by the implementing partners, and sometimes the implementing partners or the projects may have limited influence over the teaching practices as well. So it's really important to sort of, when looking at expectations on this, to remember that point as well. I don't know if anyone else from the team wanted to add.
Thanks, Shanila. Do you want to add anything, Banaza?
No, I think Rumanshi has just added a little bit of further detail on this in the chat, so no more to add. Thanks.
Excellent. So there's a question from Sadia also about the content of teacher training. So that was something. So just to clarify, we were looking at teachers and teaching from the qualitative studies. We were particularly looking at the schools and centres, not at the teacher training programmes in terms of the data we were collecting. And we were then relying on documentation, as Ramanshi was saying earlier, in relation to what the content was. And although we know that there's a lot of documentation, the information that was available to us during this period wasn't. From that we weren't able to really get into detail of those content. I think that would almost be another study. So these are good questions, but we weren't able to answer that, and it wasn't the explicit focus of the data that we were collecting. So then Gandhari, a question again from, did the research findings show improvements in children learning outcomes through these forms of teacher professional development? So Shanila, I think that goes back again to your last recommendation on the need for the linking, and Maho has done a lot of thinking about this as well, I know, in the team, of the linking of the information that's collected on teacher characteristics, etc., and the type of teacher training they're getting with the learning outcomes. So often the IDs, there weren't IDs that were connected across those two data sets. Shanila, I don't know if you want to come in, but also Maho, if you want to add anything on that.
Yeah, no, I was just going to say the point about the linking, and also the point about ensuring that these data on teachers is collected over time as well. So you can actually look at change over time. But I'll hand over, if Maho's on, she might want to talk a bit more about the data.
Yep. I think, our impossibility was to link the students and the teachers, and as well between baseline and midline, the teachers were also changing. So there were also like changes in the teacher that was interviewed, and we were limited by the fact that it was only one teacher selected in a school to be interviewed. So like a teacher will be representative of the practices that will happen in that school. So then to look at changes between baseline and midline, the teachers were also changing. So and then we were not able to link it to the classroom and to the children being interviewed as well. So yeah.
Thanks. And I think, and Simon, I know this is something that we've also discussed a lot, so I don't know if you want to add anything as well. I think it was sort of quite something that we know there's a huge amount of data that's collected and really important data, but there's always ways that we can do more to make it useful for the type of analysis we might want to do.
Yeah, I think you'll find this when it comes to across the board in many different settings, including in the UK. The holy grail is to link an outcome, i.e. in this situation, a girl's learning outcome, improvement in literacy, improvement in numeracy, whatever that outcome is, to the initial need for support, and then the intervention, so that we can get a line of sight between what projects are doing and how eventually it ultimately impacts on girls' learning. And we know that's difficult. We know that's difficult from phase one. We know it can lead to a bit of tunnel vision in terms of the only thing that important is that particular outcome. And we know from this study that's not the case, because we've lots of findings regarding, you know, the importance of teachers' well-being, the importance of teachers' role in terms of social support. And you know, it's much more holistic than just teaching and improving girls' learning. It all impacts on that. However, you know, fundamentally, you know, the role of a teacher is to teach and teach well and help children improve their learning outcomes. So I think that is a kind of key finding, key recommendation, key conclusion, that kind of focus on establishing those links is critical.
Thanks, Simon. So there are some other good questions that are connected, and Romanshi, I can see you've responded to one, but maybe it'd be good if you could just sort of speak a bit about it and maybe link it also to Barbara's point. So on the question about the expanded role that teachers took, what sort of things did the IPs do in terms of providing support to that? And then I think there's also the question that Marie-Louise has asked that you've put a response to, but if you maybe come in and just say something about that. Sure,
Pauline, thanks. So as I mentioned in the chat, teachers didn't seem to perceive their additional responsibilities as a burden, and I think they did. We saw that they felt a sense of duty, and they enjoyed the work that they were doing. However, they did feel that they required some more resources and training to support girls and also their own well-being. Though, as we mentioned in the report, IP's abilities to meet these needs were constrained during the pandemic due to a host of other factors. So the way that IPs were supporting teachers was providing resources such as phone credit, so that helped them get in touch with girls, which was really vital. They also provided a lot of health safety information and resources, and they provided learning materials as well. And one approach in particular used by a project to support teachers' own well-being was psychological first aid, and facilitators provided socio-emotional support as well.
And things like the phone credit and things was used not only to help them connect with learners, but for them to connect with their own training needs as well. So I think phone credit was seen as something that was quite valued.
Thank you. I think I'm skipping down, so I'll go back up in a moment, but I just want to come to the question by Jose on the how to link the data on teaching practices with the contribution to changes in learning. And again, this is something that we did discuss. Simon, given that you're on the screen here, do you want to start, and Maho again if you want to come in?
Just repeat that. I was just typing something in the chat box. What would you like to comment on?
So there's the question by Jose on the recommendations on how to link the data on teaching practices with the contribution to changes in learning.
Can I just come in before Simon? Sorry,
yes,
just
sure.
before Simon, I mean, I think, Jose, one of the things that we are suggesting is it's proposing how the data are actually collected, because a lot of the evaluation data, it requires a huge amount of effort. I think it's not that simple a task, but often just having the IDs of the students that the teachers are teaching and making sure that we have enough information on the children and the teachers who are teaching them, and then just having the IDs connected to link them would give us enough information to be able to link basic teaching practices with student learning outcomes. But I'll let Simon and Maho come in as well.
So it might be just as you're both responding to that, thanks, Mona, to link it with Fadimata's comment about the point that Maho was also making earlier about the high teacher turnover. So how do we do this in the context of high teacher turnover? And I know, Manazar and Shalala, we had a sort of similar experience in the work that we were doing in India, where we started by wanting to track teachers over a year, and there was a mass turnover of teachers within that year. So these are real situations, but it's also always good to think about what can be done in these contexts and with the type of data that are available.
Yeah, I mean, I think I think, I mean, there's many ways of doing it, and over the kind of 10 years of the GEC, we've, you know, lots of different ways of tracking the impact of interventions on girls' learning and how to link that have been tried. But I think essentially, given the complexities of collecting data in these environments and the high teacher turnover, and also in some areas high student turnover as well in terms of retention and dropouts, I think what's important is that we are capturing the experiences of beneficiary girls directly and asking and putting them front and center of our measurement strategies as to what are their perceptions about changes in the quality of teaching, what's their feedback on the high turnover of teachers and how it affects them. And I think as long as there's some way of linking which classes projects are intervening with and which groups of girls, even if it's not, you know, particularly statistically significant, if you like, even from a qualitative perspective, that has value. That has value. It's always trying to bring it back to ultimately, what are the girls' experience of the quality of teaching, the supply of teachers, the turnover, the pedagogical approaches, and then trying to link that to what projects are doing. Because the other thing I was putting in the note and in the chat box, and I'll put it in, it as we know, it's not just about teachers. The girls' characteristics, their households' characteristics, their community characteristics affects girls' learning as well. So which makes it extremely complicated. And then we heard Shanila talking about the political economy and the education system. So across all these domains, these three domains, teaching, what happens in school, what happens at home, what happens in the education system, all affects whether a girl learns. So we don't want it to be a kind of very linear kind of tunnel vision type of you know, approach, because that's not real world. But we do need to understand what the contribution across these three domains are to learning girls, and always coming back to how it affects girls' learning in the classroom.
Great, thanks, Simon. There's a question also that Manaz put a response to about the collecting data on learning during the pandemic, and as you know, that wasn't the intention of the GEC. So this analysis that we're talking about was in the the pre-pandemic period. Having said that, we have another work we've done in Ethiopia and Rwanda have collected data on learning after schools reopened. As you no doubt seen, there's sort of information on learning losses. We'll be hearing from colleagues also next week on the Access and Learning study that also looks at the sort of issues around learning over the period of the pandemic. So there will be more on that. There's a couple of important questions about the potential particular challenges in fragile contexts, and certainly Afghanistan in particular. I think there were some quite key learnings. I don't know, again, Manaza, Shanila, or Manchi, if any of you want to come in on that question.
I think across the board, one of the things that we did in the report that we are not able to give in detail is that we conducted a political economy analysis. So I think what that allowed us to do is almost to like set out the context of each of the three settings, and we did conducted, struggling to find the words, stakeholder interviews at the national and district level across different stakeholders. And what it allowed us to do is that it gave us a bit more of the context. I can't at the top of my head come out with very specific findings or best practice for the fragile context. What I can say is that Shanila and I were actually, and I was thinking about these comments, we were actually doing some work for the GPE, and we did interview a lot of stakeholders in Afghanistan and across many different contexts, some of them fragile. And one of the things that we did find when we interviewed these stakeholders is that basically contexts that have faced crises in the past almost seemed, now I can't say better equipped, but they seemed almost to handle things slightly differently. So I don't know, and this is not something we say in this report at all. I'm just trying to find an answer for these very interesting points that have been made. I don't know if Pauline and Shanila and Romanshi have any further feedback on this. I don't think I can pull out any specific findings on the context specifically.
One thing I could say maybe is we saw that in Afghanistan, especially, that long distances to school and security concerns and lack of transport provision is a key barrier. And as Munaza mentioned, this came out in the political economy analysis. So community-based education was quite an important means to fill this gap, as those educators were locally recruited, locally situated, and could provide education in those areas where girls otherwise wouldn't have been able to access. So I think that could be a good practice maybe that was identified in fragile contexts.
Yeah, and also linked to that, I think in terms of female teachers, they faced obviously similar things. And so another thing that was found was that for providing remote or community-based training for these teachers really helped female teachers to access training. And also there were examples of implementing partners, giving them travel allowances or giving remote learning as well, or funding to allow them to access training as well. So that was another good practice to ensure that all female teachers who may otherwise be restricted from accessing training were able to do so.
Thanks, Shanila. So we're getting towards the end of our time, so I'm going to hand over to Nidhi in a moment, just to pick up on the point about Angela's put in the chat about resilience. And I think, in my view, sort of this is one of the key aspects. I think one of the reasons why we see this sort of continuity and some of the sort of positive things that we're talking about is because of the embeddedness of the IPs, the work that they've been doing over many years. And one of the things we really highlight is the extent to which there was a lot of flexibility and adaptability in a very quick time period in the context of COVID. So I think, although there were challenges across all of the 4 contexts, we saw this adaptability in the context of Afghanistan, which obviously has undergone huge changes and challenges in its education system, but that adaptability has obviously, and being nimble has had to be a feature of the education provision in that context. And obviously, since we finished the study, those challenges have increased once again. So just to conclude by thanking all the implementing partners once more for all your engagement. As Shanila said, there are a list of recommendations in the report, so do recommend that you look at these, because I think they go beyond, and they intend to go beyond the specific IPs that we were looking at for sure. It was learning from those. So hopefully you find it useful and look forward to continued feedback. And thank you again to all the colleagues who've contributed to the report. So Louise, maybe if you could put up the slides for Nidhi, and I'll hand over to Nidhi to give us an overview of one of the upcoming studies that's going to be focusing on disability. Thank you.
Thank you, Pauline, and thank you, Shanila and the team, for a very stimulating presentation on your own project. So hello, everyone. Especially, this is just to flag what we are planning to do in the next study, which is going to be focusing on issues around disability. And it's also an invitation to connect with us, please, if you have any ideas about the kind of work you've been doing, any interventions focusing on this area. Could I request the next slide, please? So what I'm going to do here is primarily talk about the main objectives, some of the proposed research questions, and what kind of timelines we're looking at, just to give you an idea. So the objective of this study will be to understand ways in which the Get2 projects have engaged with girls with disabilities through the different interventions, and indeed the effects of these interventions on a range of different outcomes. So we're looking at learning, socio-emotional well-being, and indeed how has it impacted engagement of girls with disabilities themselves, with their peers, teachers, stroke educators, family members. So it's really very much going with the lens of understanding the impact on girls with disabilities, who are acknowledged as one of the most marginalized of the marginalized groups. So the next slide just flags some of our preliminary questions. So as stated in the objectives, we really want to understand how have the project supported girls with disabilities, and this is where it would be really nice to hear from you if you're particularly working on a project which has been working with girls with disabilities. We do have baseline, midline data, but it would be really nice to hear from you if you keen on getting involved, and also very much if there's specifically you're doing which has not been captured in the paperwork we currently have. So we want to look at how girls with disabilities supported in these interventions, and not surprisingly, approaches adopted during COVID-19. Our second research question is going to be looking at what are the perceived effects of these interventions on girls with disabilities and on educators, family caregivers, communities. And finally, what can we learn from these different stakeholders about what works well or does not work well in these interventions in relation to the inclusion of girls with disabilities in different kinds of educational arrangements. The next slide, please. So in order to answer these questions, we are proposing we will undertake a primary qualitative study, because that will really help us embed ourselves deeply in the field to understand girls with disabilities and the social milieu in which they inhabit. So we're proposing to conduct case studies of girls with disabilities in different interventions. Given the timeline and resources, etc., we'll be focusing on 2 or 3 projects, 3 being the maximum number, and we will be trying to look for a good geographical spread across different countries. We are currently in the design phase. We're getting our in terms of reference finalized. We've had some consultations with the FCDO in relation to what this project should look like. We will be launching the design phase from April to August, and that's the time we'll be selecting for different projects, and then fieldwork in September to November, with the project wrapping up sometime in March 2023. So this is just to give you an overview of the study, and again, an invitation to IPs to please get in touch with us if there are any particular interventions and projects that you think we should be definitely looking at. So I'm going to stop there, and back to you, Pauline.
Thanks so much, Nidhi. Just a specific question. What's the best way for people to get in touch for sharing information on?
I was thinking maybe I could put both 2 emails in the chat. So I am offering here Romanshi herself, who's on the call, and Larib, who's working with us in Cambridge. So both are working on the project, and I've put their emails in the chat. But I'm not sure if you do send the slide decks around to everyone who's attending, I could put the emails in the slide deck also. And I think Pauline has frozen. I think her screen has frozen.
Yes, I think.
Yeah. So I'm happy to take any questions and stand in for a minute or so there. If there are any questions, please go ahead and do ask. Otherwise, I'm going to pass it over to Manaza.
No, I just tried to come in to help. I think we're coming to the end of the proposed time as well, but if there are any questions, I'm happy to take over to chair. Please feel free to quickly ask, because we've got about 3 minutes.
Oh, I can see there's a question there in the chat, which is, does it focus on disability as a whole? As there are multiple, yes, it does focus on different aspects of disability, and also we not only just types of impairment groups, but we're also very mindful of other intersectionalities. So yes, please, it does take a more coherent and holistic view of disability.
Brilliant. If Pauline is back.
Teams threw me out. I don't know what I did wrong. But,
well, glad to have you back. We're just concluding, Pauline, so you can take over.
Excellent. Well, I think we've probably concluded, Nidhi, unless there's anything from your side. So thank you all again. It's really exciting always to share findings and to share our plans with you, because that's what's most important about all of this work. And we're looking forward to meeting you again next week to hear more about the Access and Learning study and the findings from that. So thank you again for joining, and wishing you all a good rest of the day.
Thank you. Thanks very much. Thanks, everyone.